So about 20 to 25 years ago in dentistry, the big buzzword or the big buzz phrase that all of us kind of bought into from practice consultants was the morning huddle. And God forbid a dental office out there in the United States right now doesn't start their day with the morning huddle. The problem with the morning huddle is there's never ever a debriefing at the end of the day. So what does it all really mean to us? So dentistry is a very frustrating profession, and in fact the tactical portion of the day-to-day stuff of dentistry is so frustrating that without a debriefing, your office will never really be able to attain the heights that it wants to attain. So what does it mean? Well, the morning huddle was really meant to look at the schedule, to find holes in the schedule, to identify opportunities, to talk about what our practice goal is going to be, how much money we wanted to make for the day, what we wanted our production to be. Those are all the morning huddle kinds of things. What I really liked as a dentist is when I had a debriefing at the end of the day. And what the debriefing was is me, the dental hygienist, the dental assistants, and the admins inside the office talk about how the flow of the day went. So what does that really mean? Well, let's talk about the dentist and the hygienist, that dynamic right there. So the hygienist at the end of a hygiene visit wants the doctor to come in and check. Or maybe at the beginning of a hygiene visit, she wants the doctor to come in, and if you don't have expanded functions inside your state, they want the dentist to inject the patient to get him numb so she can do scaling and root planing. What happens is the dentist is so focused on his dentistry, the crown and bridge or the fillings that he's doing, he doesn't really want to be bothered with hygiene checks or getting patients numb for scaling and root planing. So what happens then is now the hygienist becomes frustrated because she needs to do the stuff to the treatment of these patients, but she's dependent upon the dentist. The dentist now gets pulled away from the patient, and now the hygienist needs to get done. And in the meantime, the patient now is complaining to the dental assistant, and the admin is going to the dental assistant saying, your next patient is here, and you're running late, and all of a sudden at the end of the day, everybody's hating each other, and they're frustrated, and it's terrible. So where does the debriefing come from? The debriefing comes from actually from the military. They would plan for a particular battle or a particular strategy, and then the tactical stuff of the battle sometimes will go crazy. In fact, there's an expression which is, as soon as the bullets are flying, all the plans get thrown out the window. That's exactly what happens with the morning huddle. As soon as the patients start arriving and we start putting emergency in, and we're having problems with some patients, maybe getting them numb, or maybe a hygiene patient shows up late, those tactical things become so overwhelming that the plans that we had in the beginning, goal setting, revenue, all these other things, they get thrown out. So why is the debriefing so important? Because what we want to be able to do is we want to have an adult conversation at the end of the day to talk about what went right and what went wrong with the flow of the office. And once you start to figure that stuff out, the morning huddle the following day has so much more importance to it. So for example, what kind of stuff should go on with the debriefing meeting? Well, doctor, I wanted to have you come in for a hygiene check. You weren't able to do it, and I had to dismiss Mrs. Jones without a hygiene check because you were in the middle of something you couldn't stop. So what we're really looking for is solutions to those problems. So why not have the doctor go in at the beginning of a hygiene visit? Why not have the doctor go in the middle of a hygiene visit? Hygiene visits don't necessarily need to be at the end. Now, ideally, it's great if they are, but if a doctor's about to start a 2-hour procedure, there's no reason why he can't go into the hygiene visit either at the beginning or at the middle to check the hygiene patient, have a discussion with the patient, and then dismiss himself and allow the hygienist to finish everything up. Or if we know that there's going to be scaling and root planing being done and we need anesthesia for that procedure, the dentist needs to know that and understand kind of the demands of all of it so that he can talk to his patient and say, listen, I have a patient in hygiene that needs my attention. I have to get them done so we don't hurt them. And in our practice, hurting people is something that we're very, very cognizant of, and we want to make sure we hurt no one. So just give me 5 minutes. I'm going to run into hygiene, take care of this patient. I'm going to come back, and I'm going to finish up your procedure. Patients are okay with that. And at the same time, the dental assistant complaining to the admin saying, you're sticking in all these emergencies, and all of a sudden we're running behind. There's ways to stick in emergencies to kind of keep the flow of the practice going. Those are the kinds of things that you discuss at a debriefing. So this way we're able to educate everybody within the office of all of the angst that we have with the flow of the dental office. So now in the following morning, it doesn't turn into a bitch session about all the things that went wrong the day before. It turns into something really positive, which is production and patients and where we have holes in the schedule and how we're going to fill them and how we're going to kind of maybe cross-refer between hygiene and restorative dentistry. So use the morning huddle for what it's supposed to be and start adding to your to your armamentarium of how you run the office, which is the debriefing at the end of the day. The hygienist, the assistant, and the admins, and the doctors, we all have frustrations. And if we communicate that at the end of the day and understand where each of these frustrations start to kick in, just by eliminating a little bit of that frustration, by understanding the scheduling and understanding the demands these patients are putting on us, will allow us to really achieve the goals that we set out in the morning huddle. So you have the morning huddle. Please, please, please add a debriefing session to your office flow, which occurs at the end of the day and should really only last maybe 5 to 10 minutes. That is really the most important take home to this entire video right now. Morning huddles are important. Debriefings are probably more important to get that flow taken care of, and then the morning huddles will mean more to your practice production. Thanks.